Hello, are you my 3 o'clock? Come on in. You can get settled on the examination table. So I am Dr. Sandbox and I'll be treating you today. I'm just going to get my mask on and my gloves on and then we'll get started. Strap over my head. Okay, got my mask on. And now I'm going to put on my purple gloves. So, why don't you go ahead and give me some basic information. Let me make sure I have your name correctly. Can you spell it for me? Yeah, okay, let me just type that on my computer. Yeah, I love that name. It's beautiful. Okay, and your date of birth? Okay, that's already correct. Wonderful. So, what is it that brings you into my clinic today? Oh, I'm so sorry to hear that. Headaches can be so uncomfortable. Alright, well, we're going to take good care of you today. I'd like to know a little bit more about your headache. When did you notice it starting? Okay. Is there anything that makes it worse or better? Okay, yeah, that's pretty typical. Gotcha. Okay, yeah. And how much would you say it's affecting your life on a scale from 1 to 10? Okay, 6. Yeah, that is significant. Anything else you want me to know about where the headache is located or what it feels like? Yeah, I really like that description. I mean, I don't like that you're experiencing the headache, but that's a really helpful way to describe it. Alright, well, I want to do a few tests just so we can try to get to the bottom of what is causing these worsening headaches. I'd like to start with a special nasal swab test, and with just this one cotton swab we can actually test for 7 different viral infections. So I want you to just relax your neck, relax your shoulders, and I'm going to circle this cotton swab in each nostril 5 times, okay? I'm not going to push very deep or very hard. You ready? Yes, absolutely. Okay, we'll go slow. Ready? 1, 2, 3, 4, 5. Good. Yeah, just take a deep breath. You got this. Okay, next nostril. 1, 2, 3, 4, and 5. Alright, I'm going to pass this off to my nurse, and he's going to get that in the testing machine. Okay, so we're going to find out if you have any viral infections, but let's also just make sure that your eyes are working correctly, because sometimes eye problems can lead to headaches. Okay. First, I want you to look at the tip of this blue pencil, and just follow it with your eyes. Very good. Now notice when it disappears. Okay, good. And now when it disappears on this side, and good. Alright. Now I want to take a look in your actual eyeballs. So first I'm going to have you look up. Yes. Okay, and now look to this side. Good, now this side. Good, and now down. Okay, your eyes are looking okay to me. Does the light feel extra bothersome? Yeah, okay. That's good to know. Let's try this side. How does the light feel? Okay. Okay, well, thank you for telling me. Okay, next I want you to move your neck around for me. Tilt your head from side to side. Very good. Now tip it down, tip it back. Okay, good. I'm just gonna feel the side of your neck, if that's okay. Okay. And this side. Yeah, I can feel a little bit of tension. Is that more tension than you normally have in your neck? Okay. Well, that could be a contributing factor. Oh, my nurse is back. Thank you so much. Okay, I have the results, and negative, negative. All right, all 7 tests were negative. So it looks like you don't have any viral infections, so that's a really good sign. I know you're still dealing with these headaches, so let's see if we can do a few things right now. First, I want to have you do some belly breathing. So instead of breathing into your chest, I want you to breathe into your belly. Okay, go ahead and try that for me. Very good. Okay, next we have this special new technology. It's Bluetooth enhanced cold packs for your head. You can see there's this little hole here for your nose, and we can just put this right over your head, and the gentle coolness can help provide some relief. Do you want to try it on now? Okay, yeah, let's just put that on you for a minute. Ready? Here we go. Okay, now how do you feel? Okay, I want to ask you a few more questions. Have you been dealing with any additional life stressors recently? Okay, I'm just going to write this down. And how's your social support? Like your friendships, family, how are those relationships? Okay. I see. Okay, and how have you been sleeping? Ah, okay. You know, moving to a new house or a new city, like that can be such a huge transition, and it's possible that that is one of the driving factors behind your worsening headaches. What do you think about that? Okay, I have a suggested treatment plan for you, and I'd love to see you back in about a week, unless things get worse, and then I want you to come in as soon as possible. Okay, so I'm going to send this special ice pack home with you, and try to use this 3 times a day for 10 minutes at a time, if possible. Now, if you only have time to use it twice a day, that is okay too. Okay, yeah, this is for you to keep. So, ice pack 2 or 3 times a day. I'm going to write all this down for you, but I'm just going to explain it first. Okay, and then we have this Tiger Balm. Have you ever tried Tiger Balm? It can feel really nice on sore muscles, so this is something you can use topically on your neck or on your the sides of your head, and this can just provide a little bit of temporary relief. Yeah, okay, so we'll put that aside for you. Do you prefer taking Tylenol or ibuprofen? Yeah, just whatever you normally take, feel free to take that according to the directions on the bottle. And if in a week you're still having pain, we can move on to a prescription medication. Yeah, okay, so you've moved to a new place, and I'm a medical doctor. I'm not a mental health therapist, but I can tell you that there is significant medical scientific evidence that having a good social support structure is really beneficial for health and for pain relief. So I know that it takes time to adjust to a new place, it takes time to meet new people, but I just want to gently encourage you to get out there, maybe say hi to your neighbors, maybe find a church or a club to go to, and keep in contact with your friends and family from where you used to live. Yeah, it's absolutely worth it. Yeah, social connection is so important. Okay, it sounds like your sleep is really troubling you, so I would like to write you a prescription for that. This is something you can take as needed. You don't have to take it every night, but it's an option for you because if we can get you sleeping better, then I'm wondering if your stress and your headache will improve. Okay, I'm gonna write this down. Okay, 50 milligrams up to once daily. And I'm gonna write both the name brand as well as the generic, whatever your pharmacy has, whatever your insurance will cover. And this should be enough for 30 days. And I'm not going to give you a refill for now because I'll see you again in a week and we can go over then if we want to continue on this medication. Okay, so I just need to sign this. Very good. Okay, I'm going to hand this to you. You can just take this to your pharmacy, get that prescription filled, see if that helps with your sleep. Remember, you can take over-the-counter pain medication and use this head cooling device and this Tiger Balm for pain. Are you up for hearing one more suggestion? Okay, great. So we have some mental health therapists that we refer to. We refer some of our patients to, and they use a type of therapy called dialectical behavioral therapy, or DBT. And it's something that I've really benefited from myself. And if your stress continues to be high and your pain continues to be ongoing, DBT can be a helpful way to both manage stress and pain, and also like deal with it in a productive, constructive, and accepting way. Yeah, I just wanted to let you know that's an option. We can absolutely talk about it more another time. Okay, well, are there any other questions you have for me? Breakfasts. Yeah, I'd recommend something high protein, something with a lot of good micronutrients. Yeah, that sounds good. Just keep eating that. Any other questions? Yes, my receptionist will give you a business card on your way out, and that way you can easily give us a call if you have any questions or if you need to come in again before next week. Thank you so much for coming to see us. I'm Dr. Sandbox, and it's so nice to meet you. We want you to feel cared for and at home in this new city of yours, and I hope you'll come back to see us soon, but I also hope that you feel better soon. Yeah, it's so nice to meet you. I'll shake your hand, and I look forward to seeing you again soon. Thanks for stopping by. Bye for now. Hello, I'm Dr. Sandbox. Welcome back to my office. Go ahead and get seated and we'll get started. I'm gonna put this beautiful blue mask on. I love the color too. Fits well. And as I get my gloves on, I just want to say welcome. It's so good to see you again. Am I right that it's been about a week since your last appointment with us? Okay, great. Well, we want to continue working on your issue of ongoing headaches until we figure out what's going on and how we can help you. How does that sound? Awesome. Okay, so tell me the updates. how has your sleep been? Okay, I'm just gonna write this down. Your sleep. Tell me about your sleep. Okay. Yeah, that makes sense. Okay, and the sleep medication, do you feel like that's making any difference, positive or negative? Okay, yeah, you know what? Small positive difference is still something to celebrate. How has your pain been recently? Your head pain? Okay. Is that the same or different as it was, say, like 2 weeks ago? Okay. So there really hasn't been much change. Okay, yeah, that's okay. It's good to know. So we still have some work to do to get you into a place of greater health and less pain. So here are my ideas. One, I want to do some more blood work on you. I want to get your thyroid tested, electrolyte levels in your bloodstream, vitamin D levels. We're going to check some markers for autoimmune diseases, viral persistence, inflammation, and hormones. So before you leave today, my nurse can draw that blood for you and we can get those things tested. Yeah, right now we're just trying to explore all the different possibilities of what could be causing your ongoing headaches. Yeah, for sure. So the other thing I'd like to do today is a cranial nerve exam. And this is just a painless way for me to examine the nerves and muscles in your face and neck region. Does that sound okay? Okay, great. Like I said, you shouldn't feel any pain, but if you ever do, I want you to let me know. And we can pause or adjust or take a break. I want you to take some breaths for me. Just breathe normally. I'm just going to observe. Okay, good. Good, good, good. Now take a deeper breath. And out. Very good. Okay, do you wear glasses or use hearing aids? Okay, let me write that down. Have you noticed any changes in your sense of smell? Okay, that's a good sign. So the first test I want to do is a smell test. So I have this gentle fragrance. It smells like beautiful flowers. And I'm going to hold this far away and I'm going to gradually bring it closer to you and you let me know when you can smell it, okay? Ready? Here we go. Okay, good. Now let's do that again. Okay, very good. Okay, no abnormalities with smell. That's a good sign. Next, I want you to cover this eye, or I can cover it for you. Yeah, just read as many as you can. Okay, very good. Alright, now the other eye. We're going to cover this one. You just tell me how many of these numbers you can read. Okay, excellent. You just keep your eye on these numbers. Good. Okay, now look at this number in the middle, the 5. Do that again from a different angle. Very good. And from here. Okay, good. Keep looking at the 5. And okay, very good. I'm going to hold my fingers out to the sides and I'm going to wiggle either this finger or this finger. I want you to keep looking right here at my blue mask and just using your peripheral vision, I want you to let me know which finger you see moving. Very good. Okay, keep looking at my mask. Very good. 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 Awesome. Okay, good job. Okay, we're going to continue testing your field of vision. I'm going to cover this eye, and I just want you to let me know when you can see this finger. Okay, good. 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 Okay, now cover this eye. Let me know when you can see my finger. Good. 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 Alright, your field of vision is looking good. Now, follow my finger. It's going to start out far and it's going to get close. Good. Okay. Again, starting from over here. Good. Now over here. Follow my finger with your eyes. Good. Okay, do you notice any pain? Great. No pain. Okay. Okay, now I'm going to test your eyes' reaction to light. You're doing really good. Are you in any extra pain right now? Okay, good. Well, we will proceed. So first I'm going to check this eye. Just notice how your eye responds to having the light close. Good. Okay, now the other eye. Good. Good. Okay, now we're going to go back and forth. Yes. Okay, your eyes are responding as we would hope they would. It's a good sign. Good. Very good. Okay, now we're going to check your chewing muscles. Can you open your mouth for me? Okay, and now close your mouth and clench your jaw. Okay, do that again while I gently touch the sides of your face. Clench, unclench. Okay, now up here. Clench, unclench. Okay, your muscles are working well. Very good. Okay, now I'm going to test your facial sensations. I'm going to use this very soft Q-tip. I'm going to show you what it feels like just on the side of your neck. Okay, does that feel comfortable? Great. So all you need to do is let me know if you feel it. I'm going to put it on different parts of your face and you just say yes, meaning you can feel it, or no, you can't feel it. Okay, just relax. Oh, and close your eyes. Close your eyes and let me know if you feel this. Okay, good. Keep your eyes closed. Good. Okay. How about now? Good. Good. Can you feel this? Okay. Does it feel the same or different on this side compared to this side? Okay, good. Over here. Yes. 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 Okay, you've got really good sensation in your face. Have you noticed any changes in your sense of hearing? Any ringing or echoes, muffled sounds? Okay, so what I'm going to do is I'm going to gently make some swooshing noise with my gloves, and I'm going to at the same time whisper a number. And you let me know what number I'm saying, okay? 5. 5, very good. Okay, again. 10. Very good. Okay, one more. 1. Awesome. You are hearing things really well. Okay, just a couple more components to our cranial nerve exam, and then we will get you into the blood draw chair. Okay, can you swallow for me? Good. Okay, now cough. Good. Now say ah. Okay, now say ah again while I look inside. Ah. Okay, everything looks balanced inside your throat. That's good. Now shrug your shoulders up. Now keep your shoulders up while I try to push them down. Okay, very good. Relax your shoulders. Now turn your head to one side. Okay, now I'm going to gently put my hand on your jaw, and I want you to resist me as I try to push your head that way. Okay, good. Now turn your head the other way. Resist me as I try to push your head further. Okay, very good. Do you notice any pain on either side of your neck when you're doing those movements? Wonderful. Okay, my friend, you have done such a good job on this cranial nerve exam. I'm just gonna let you know my general findings. So, no abnormalities detected. So that's a really good sign. We've ruled out several things that could have been causing your headaches. So the next steps will be to get that extensive blood panel done, just to see if there are any imbalances or signs of infection or inflammation. I also love to refer you out to a physical therapist who specializes in myofascial release. Sometimes headaches can be either caused or worsened by tension in the fascia or muscles. So myofascial physical therapy is one of the most gentle types of physical therapy, and we have some wonderful physical therapists we refer out to. So I want you to consider it. I'm going to go ahead and write you a referral and call that in to the PT office, and you can decide if you want to go or not. Okay, also, what did you decide about dialectical behavioral therapy? Yeah, well, do you think that's something your health insurance would pay for? What health insurance do you have? Okay, yeah, I think it'd be worth giving them a call and seeing if your health insurance would cover that. Reminder, DBT, or any kind of mental health therapy, is not a cure for physical pain. But sometimes specific modalities, such as dialectical behavioral therapy, can help us learn how to better manage and accept our pain and anxiety. Yeah, I'm not saying that this is all in your mind or anything like that. I'm just wanting you to be as a resource as possible as we continue on this journey towards addressing your headaches. Okay, so I want to see you again when your blood results come in. That'll probably be in a few days, so I'll have my receptionist give you a call, get you on the schedule, and we can go over those results and talk about next steps. Do you have any questions for me? I know that chronic pain can be such a long and weary journey. Okay, yeah, great question. So possible next steps after the blood work would be referring you out to a specialist who could do an MRI or CT scan for your brain and neck. Yeah, that would just be a way to check for structural or functional abnormalities of the brain. Yes, but I just want to assure you again, we're going to keep digging, keep working until we find what's wrong and how we can help you the best we're able. Yeah, I'm really proud of you for persevering through all this pain and all these doctor's appointments, and just want to remind you to keep taking good care of yourself, keep connecting with people who care about you and who you care about. Yeah, you're so welcome. I actually have one little thing for you before you go. This is a wonderful microwavable, reusable heating pad. Look at the beautiful lemon pattern. And inside is feed corn, which can go in the microwave and does not turn into popcorn, don't worry. And if you put this in the microwave for 1 minute and then let it sit for 10 seconds before taking it out, and you can put it on your shoulders, you could put it on the bed and lay your neck on it, you can put it along your spine. This just might provide a little bit of relief for some of your pain. So I'll get this wrapped up for you and you can take this home. Give it a try. See how it works for you. Okay, any final questions? Okay, and would you like a refill for this sleep medication? Yeah, absolutely. I'll get that sent in and then you can decide if you want to keep taking it or not. Awesome. Well, thank you so much for coming in today. You did a wonderful job. It's really very wonderful news that there are no abnormalities in the nerves of your face and neck, or at least none that we can detect from a cranial nerve exam. And I'll probably see you back in two or 3 weeks. Yeah. Thanks so much for coming in today, and I hope things start to feel better for you soon. Take care. Bye for now. Hello. Come on in and get seated. Welcome back. It's so good to see you again. I think this is your 3rd appointment with me. Awesome. Well, as you know, my name is Dr. Sandbox, and I want to start out by saying that I heard you went to your appointment to get your brain scan with Dr. Uchimura, and I'm really proud of you. I'm going to get my gloves on, and then we will get started. Why don't you start by giving me an update on how things have been going for you? Okay? I'm just going to take some notes, okay? Okay. Yeah, and how was that procedure? Okay. Yeah, that's good. Did Dr. Uchimura already go over the results of the brain scan with you? She did, okay. Well, she told me that your brain scan showed mild blood flow restriction in 2 different areas of your brain. Was that your understanding as well? Okay. And how did it feel to hear that? Yes, that makes sense. Yeah, I think it really does help provide some good context for the ongoing headaches you've been experiencing. How have your headaches been recently? Okay, and about how frequently? Okay, and is that about the same or better or worse than before? Okay, yeah, that makes sense. Now, Dr. Uchimura mentioned that when you had your follow-up appointment with her to go over your brain scan results, that you mentioned noticing an increase in fatigue. Yeah, tell me about that. Oh, okay. So when did you notice that starting? Okay. And tell me more about what that feels like. Okay. Yeah. You know, I know that we had talked about if fatigue was something you were dealing with when you first came in, and at that time it didn't seem to be a symptom that was standing out to you. But the fact that it's something that's developed over the past 2 months into a symptom, that's a really important piece of information. So I'm really glad that's something you noticed and talked with Dr. Uchimura about. Well, last time you were here, I had you draw some blood and we tested you for several different things, and everything came back normal except for your extensive viral testing, where we tested to see if there was any residual viral fragments or viral persistence in your various tissues in your body. Yeah, sometimes our bodies have trouble getting rid of a virus and it can get stuck in our body and continue to cause problems. So we will go over the details of that in just a minute, but I'd like to start by just getting a brief exam done, okay? So I want you to sit still, sit up tall, and now just move your neck around. Move your neck back and forth, round and round. Do you feel any pain or discomfort? Okay, up and down. Very good. How about any muscle fatigue? Okay. I'll make a note of that. I want to do some specific tests of the nerves in your arms and hands. So if you'll hold out this hand for me and make a tight fist. Hold that for about 5 seconds. Very good, and release. Now shake out your hand. Now push against my hand. Yeah, as hard as you can. Good, okay. Now take your other hand, make a fist as tight as you can, hold it for 5 seconds, 2, 3, 4, 5, release, shake it out. Now push hard against this hand. Okay, good. Now let your hands relax. How do your hands feel now? Any tingling, numbness, weakness? Okay, now I want you to move your eyes around in a circle. I'm going to move this pink pen close. Keep your head still and just do the best you can to follow the pink marker only with your eyes. Okay, good. Now the other way. Good. Okay, relax your eyes. How do your eyes feel? Any pain, discomfort, blurriness? Okay. Now I'm going to check some of the sounds in your upper chest. I've got my stethoscope here, and I'm just going to gently tap it right below your shoulders. It shouldn't hurt at all, but definitely let me know if it does. Okay, ready? Okay, how does that feel? Okay, good. Now I'm going to use this to listen to your heart. Take a deep breath in for me. Hold it and release. Okay. Again, deep breath in. Hold it and release. Okay, I'm just going to listen to a couple other parts of your lungs. Okay, keep breathing normally. Breathe normally. And now deep breath in. Hold it. And deep breath out. My tests of your lungs are inconclusive. I'm looking to see if there is any evidence of scar tissue or inflammation in your lungs or any blood restriction. And because I can't tell just from listening, I'm going to try to get you in for a more extensive lung capacity and lung function test soon. Now, we're going to test the rest of your arms. So first I want you to hold out this arm. Just hold it out straight. It doesn't need to be perfectly straight, just mostly straight. Now I've got this rough piece of fabric, and I've got this very soft fabric, and I'm going to ask you to close your eyes, and I'm just going to touch along different parts of your arm, and you tell me if you're feeling rough or soft. First, let's touch it with your hands. Does that feel comfortable enough? Okay, good. Alright, go ahead and close your eyes. Close your eyes and hold out this hand. Okay, tell me, rough or soft? Rough, very good. Okay. Rough, good. How about now? Soft, good. Now, soft, good. Okay. Both, very good. Alright, relax that arm down. Okay, I'm just going to take this pen and you tell me if you can feel this, okay? I'm going to hold your shoulder in place. Can you feel this? Yes. This? Yes. This? Yes, yes. Okay, great. Seems like the nerves on the outside of your arm are working great. Let's try the other arm. Okay, go ahead and close your eyes. Close your eyes and hold out your other arm. Tell me, does this feel rough or smooth? Rough, very good. Okay, now this. Soft, good. Now, rough, okay. Now along your hand. Smooth, very good. Okay, now keep your eyes closed, relax your arm down, and I'm just going to touch it with this pen. Can you feel this? Good. How about this? Good. This and this. Now hold out your palms like this in front of you, and I'm going to touch either your right palm or your left palm, and I just want you to let me know which palm you're feeling by moving it. So if I touch this one, just make a quick fist to let me know that that's the hand you're feeling me touching. Okay, so hold out your palms. Good. Okay. Good. Good. Okay, now I'm going to touch a different part of your palm. Very good. Okay, go ahead and relax your arms. I know it can be scary getting a new diagnosis or trying to get a new diagnosis, but I just want to let you know that we are here for you and you are doing a great job. I want to give you your blood test results. So we tested you for 7 different viruses to see if there is any viral persistence that you're dealing with. And as you can see, 1, 2, 3, 4 of them were negative and 1, 2 were positive. So this doesn't mean that you have an active infection of these 2. It just means that there's some residual viral activity in at least a portion of your body. And that can contribute to fatigue and to headaches. So this is your copy. You can take this home. Okay, so given the results of your blood tests, your brain scan, and your self-reporting of symptoms, I'm going to make the initial diagnosis of post-viral syndrome. This is a broad category of illness that can happen when our bodies are not able to fully get over a viral infection. So your blood results show that you have 2 different viruses that have stayed in your system and may be affecting your current health. So a little more about post-viral syndrome. The mechanisms can include brain inflammation or impaired blood flow in the brain, which can contribute to headaches or brain fog. Another mechanism is damage of the blood vessels all throughout the body. Not necessarily all at once, but it can be anywhere in the body. Viral persistence, we already talked about that. And then immune system depletion or upregulation. Yeah, not quite an autoimmune disease, but kind of heading in that direction. So common symptoms of post-viral syndrome include fatigue, pain in the head, muscles, and nerves, sleep troubles, shortness of breath, mental exhaustion, and allergy-type symptoms. Okay. Yeah, sometimes it's not till we hear a list that we recognize, like, oh yeah, that is something I've been dealing with. Okay, yeah. So you definitely have some of those symptoms, and then your brain scan and your blood test lend weight to this diagnosis. Yeah, I know. I bet it can be kind of scary, but I just want to remind you that we don't have a foolproof cure for this diagnosis, but we do have a lot of treatment options available to us. I want you to take this diagnosis seriously and take the treatment protocol seriously, but I don't want you to panic. We're here with you and we're going to help you. So I don't want to overwhelm you, so we're gonna keep this appointment pretty short, and I'm gonna have you come back in 4 to 6 weeks and we'll go over the second part of the treatment plan. But the first part, we're going to do two main things. I'm going to start you on some medications. I want you to do 2 months of prescription antivirals to see if we can clear some of the viral activity that's ongoing in your body. Okay, and then did I say 2 months? Yeah, okay, 60 days. Take 2 pills twice a day for 60 days. If you have any problems or questions, of course, you can call our clinic at any time. Okay, so this is for your antiviral prescription. And then I also want to get you started on an anti-clotting medication. So aspirin is a non-prescription, over-the-counter anti-clotting medication, but I want to get you started on a prescription one. This may help with blood flow in your brain, and it will just help make sure that you don't have adverse cardiac events. So this is something we'll have you on probably for at least 3 months, but we'll check in again in about a month or a month and a half and see how it's going. Okay, any questions about those 2 prescriptions? Okay, great. The other thing I want you to start thinking about is work accommodations. So because your symptoms have gone from mild to moderate over the past 2 months, we want to do what we can to make sure the symptoms don't progress too severe, okay? So the goal is to gradually decrease your level of activity until we get to a place that most days feels manageable. So tell me a little bit about your work situation. Okay, and how many days a week is that? And is working from home a possibility? Okay, yeah. Well, here's my recommendation. Why don't we see if we can have you work from home for the next 4 weeks, I will take care of the paperwork to send in to your boss. And that will mean that you don't have your commute time, and there will be fewer external stressors in your work environment. You can make sure you're seated in a really comfortable position. So if you can work from home for 4 weeks, see if that drops activity level and exhaustion levels just a little bit. See if that helps with your headaches. And then we'll go from there. If we need to decrease activity and exertion further, we'll do that. But let's start by having you work from home. Yeah, I will fill out the paperwork and get that sent in to your employer. This would be considered a short-term disability accommodation. How does that sound? Okay, great. Well, I don't want to overwhelm you, so that's where we're going to pause for today. So go ahead and get those medications filled, get started on those, and work on decreasing activity till your fatigue and your pain is not getting any worse. Yeah, absolutely. So when you come back in about 6 weeks, we're going to check in on how your medications are going. I might talk with you about the concept of pacing. We'll talk about some strategies for avoiding getting additional viral infections. I'll teach you how to do symptom tracking. There might be one more medication we add to help with brain inflammation. And we will get that extensive lung scan and testing done. I know this is a lot of information. I do want you to be careful. Your health is so valuable, and you are so valuable. Please be careful. We don't want this illness to get worse. But there is reason to be hopeful. You were so wise to come into our clinic 2 months ago when you initially started noticing these ongoing headaches. Yeah, I'm hoping that because we caught this so quickly that we will minimize the effects of this illness on your life. At any time, we can provide you information about support groups for people who have been recently diagnosed with post-viral illnesses. We'll get you scheduled to come back in 6 weeks, and of course, call anytime. Yes, I just want to say I'm really proud of you. It's hard dealing with symptoms that are ongoing, and you're just really brave. I'm gonna send over the notes that I took so that you can have a record of them at home. Yeah, absolutely. Any final questions for me? Okay. Yeah, well, my nurse and receptionist will get you checked out, and I will see you again in 6 weeks. Thanks for coming in. You got this, my friend. Bye for now. Hello. Welcome back. Come on in and get seated. Feel free to prop your legs up. Okay, so last time you were here, I diagnosed you with post-viral illness syndrome, and we started talking about next steps. So today I just want to check in and see how things are going and answer any questions that you have. So I'm going to pull up your chart, and I'd love to hear any updates you have for me. Okay, so tell me what you've been noticing. Okay, good. That makes sense. Okay, and how often would that be? Okay. So you've been working from home. How's that been going? Okay. And any changes in your pain levels or your fatigue levels? Okay, how would you rate that on a scale from 1 to 10? Okay, it sounds like your symptoms are mostly stabilized, meaning they're not getting worse, which is great. Okay, medications update. Okay. Good, you finished the antiviral. Okay, good. Now, it says here in your chart that you were able to connect with a specialist. Tell me about that. Okay, good. And how are you feeling about continuing to receive treatment from her? Love to hear that. Okay. Oh, a Zoom support group. That is such a great idea. Yeah. Does it feel good to connect with people who can understand what you're going through? Good. Good. Okay, well, I'm just going to do a brief exam, and then I've actually put together, or I've had my nurse put together a little care package for you. Okay. I've got this purple pen light, and I'm just going to test your reactions to light, okay? Good. Closer. Good. Okay, now the other side. Good. Good. Now, keep your eyes still. Your eyes right here. And I'm just going to move this around. Pay attention to the top of my shirt instead of the light. Good. Okay, now I want you to look at the light and keep your head still. Gently follow the light back and forth. A little closer. Back and forth. Okay, now I'm going to get real close to your eyes and just look inside them, okay? If you can look up. Okay. Yes. Looks good in there. Okay, now the other eye. Look up this way. Very good. Okay. Okay, well, I have this beautiful ocean-themed bag with a little button on it that says, "Be kind." And we're going to fill this bag with things that might help you as you continue to adjust to your new diagnosis and some changes in your lifestyle. So first of all, we want to keep careful track of how you're feeling. Having this cute little pad of paper, this beautiful pen, can help you track your fatigue levels, your pain, your appointments, all those sorts of things. Yes, we don't want to be panicky, but we do want to manage your energy wisely and carefully. So, first two things in your care package. You tested positive for viral remnants of 2 different viral illnesses. And one of the most important things we want to have you do is avoid future infections. So we want to avoid catching an illness from touching a surface that a sick person has touched, And for that, you can use hand sanitizer or hand soap, especially before eating or in medical environments or when you're around someone who you know is sick. So you can have this extra moisturizing but still disinfecting hand sanitizer. There are also some viral illnesses that are spread via airborne particles just from a sick person breathing or speaking or coughing or singing. And so my recommendation is that when you are indoors with other people, see if you can purchase a HEPA air purifier, set it kind of near the middle of the room, and have that running as high as possible, and that will help filter out the viruses, catch them in the filter, so that if there's someone sick, then they're less likely to get other people sick. Okay, so another option I recommend you consider is wearing a respirator style mask. So these are great because they not only block droplets, they also block aerosolized particles. So I have a few different styles to give you. This is a green KN95 mask from Planet of Kind. Here is another KN95 mask from Kind, but this one is purple and a different shape. So I just want you to have options and choose what feels most comfortable. Okay, here's another brand. This brand is called BNX. And this is an N95 mask. It also has around the head loops. Okay, so you can see if you like this style. And then finally, this is one of my personal favorites from the brand Well Before. We have this beautiful light pink color, and this one goes around your ears, and it is adjustable. So I recommend wearing some sort of mask like these when you're at medical appointments or anywhere that's crowded and indoors. Yeah, if you need any other recommendations, you can just call our office. How is your sensory sensitivity like to light and sounds? Okay, let me write this down. Okay, well, if it becomes an issue, I recommend getting blackout curtains and an eye cover. Yeah, absolutely. Maybe some noise canceling headphones. Yeah, that would be good. When you're working at home, are you experiencing any pain? Okay. Yeah, well, I have one thing you can try, and it is wearing compression socks. Cotton and spandex. They're nice and long. And they should be the perfect size for you. Look at those cute stripes. And these can just help provide some relief from pain and help you maintain good circulation. Yeah, any brand is totally fine, just so long as it's comfortable and helps you feel good. But this is just one you can try. Okay, great. I don't know if you can tell, but you do seem a lot more calm and accepting this appointment compared to the previous one? Yeah, I mean, it totally makes sense. You had just been given a lot of new information, and it takes time to process that. And that is okay. Yes, I'm still so proud of you. And I'm glad that the support group has enabled you to be more accepting and feel more resourced of your current needs and limitations. Good. Okay, well, the last thing I have is actually just a fun thing. So this is a cozy sweatshirt, and it says, "You are loved and capable." You are loved and capable. Nice long sleeves. Nice crew neck. Bright letters against this black background. And this is just to remind you that you are valuable, and you are loved, and you've got good support as you continue on this challenging journey. So this is for you, and you can take this home and enjoy these things as you desire. Do you have any questions for me? Okay, yeah, I would say just kind of track that and see if it changes over time. Yeah, but I'm not concerned about it right now. I'll just make a note of it in your chart. Oh, well, you're so sweet. You're very welcome. This is my job. I'm Dr. Sandbox, and I'm here to help you. And I'm really thankful that we have been able to catch your illness so early on. Yes, absolutely. The fact that your symptoms are already kind of leveling off, and some of them are even improving a little bit, is a really good sign. Okay, so you have more appointments scheduled with the specialist? Okay, good. So we're not going to schedule another appointment with us for you, but if anything does come up, feel free to give us a call. Yeah, absolutely. Well, you're very welcome, and you're doing a good job. So thanks so much for coming to see me. I'm Dr. Sandbox, and you are welcome here anytime. As your new sweatshirt says, you are loved and you are capable. Hope to see you sometime.